Good evening. My name is Shagun Idowu, and I have the privilege of serving as the Executive Director of BECMA, or the Black Economic Council of Massachusetts, the chief advocacy organization for Black businesses across the Commonwealth. This August is Black Business Month, and with Primary Day 6 days from now, we have taken it upon ourselves to label these next few days as Civic Engagement Week. We started off our series of candidate forums Monday night, and were joined by those seeking a seat in the 4th Congressional District. Last night, we continued our series by hosting the candidates for the U.S. Senate. We were fortunate that both Senator Ed Markey and Representative Joe Kennedy joined us for the discussion. We continue this conversation on what our congressional representatives will and should do for Black and Brown businesses tonight. We have invited the candidates for the 8th Congressional District to join us to share their proposals to address our issues. Both candidates had confirmed, but unfortunately, we will not be joined by Representative Stephen Lynch tonight. Many of you may have seen the recent tragic news that the body of Sergeant Elder Fernandez, a Brockton resident who was stationed at Fort Hood in Texas, was found dead early this morning. On behalf of our members, our partners, and our board of directors, we send our deepest condolences to his family, his friends, and his community. Sergeant Fernandez lived in the 8th Congressional District, and so Representative Lynch has indicated that he is traveling to Fort Hood tonight to be with the family. He sent the following letter to us this afternoon. Dear Shagun, thank you for your kind invitation to join your candidates forum on Wednesday evening. Unfortunately, as I know my campaign staff has explained, I am involved in the case of a young soldier, Elder Fernandez from Brockton, who has been reported missing from the military base at Fort Hood, Texas. I am joining the Fernandez family there. My flight and travel schedule will prevent me from joining your group at the planned time. However, I would respectfully ask you to allow me to engage in a meaningful discussion with your group at a time that works for all of us. I have been working on initiatives with Chairwoman Maxine Waters, our Financial Services Committee, and my FinTech Task Force as part of the CARES Act and HEROES Act, along with efforts in follow-up legislation to address low success rates in accessing financial support among Black and minority-owned businesses. I would love to have a discussion about how we can be more helpful. As you probably know, there are federal initiatives that offer new opportunities for Black-owned businesses, as well as innovative local participation models that have shown promise. It would be helpful to spend some time discussing what options are available and to get your members' input on how we can improve on these federal, state, and public-private partnership models. I look forward to working with you to make meaningful and lasting progress. Again, please extend my sincerest apologies to your group. I look forward to hearing your thoughts, your goals, and your concerns. With warm regards, Representative Stephen Lynch. I will note that we did send the Lynch campaign your questions earlier today that will be asked at this forum. We have not yet received a response to those questions, and so unfortunately, his viewpoints and specific plans will not be shared. Events like tonight are important because they allow us to hear directly from political candidates what their specific plans are to address our lingering issues, but also it allows them to hear from us. BECMA and its partners know that beyond the services we provide to our members, making sure their voices are heard in city or town halls, Beacon Hill, and Congress are crucial to ensuring our issues are addressed in long-lasting and meaningful ways. Our members have indicated how important it is that whoever wins the election is a champion for the causes that will help them grow their business and their community. Those issues will be highlighted tonight. I'd like to thank our team, Jessica Pierre, Tiffany Caldas, and Nicole Obi, our board of directors, and our partners, Amplify Latinx, the Black Economic Council of the Berkshires, CommonWealth Kitchen, EforAll Roxbury, Equitable Opportunities Now, the Initiative for a Competitive Inner City, the NAACP of the Berkshires, and the North American Indian Center of Boston for helping to make this series of events happen. Lastly, these discussions would not be possible without capable and professional journalists who will take the reins from here and engage the candidate in questions from the audience and our partners. I'm very proud to be able to introduce a son of Boston who will lead tonight's discussion, the voice, the chronicler, and the conscience of Black Boston, Mr. Yawu Miller. Yawu, thank you for being here tonight. I yield the floor to you.
Good evening, and welcome to night 3 of Civic Engagement Week, where this Black Business Month Congressional Forum has invited the candidates for the 8th Congressional District. Again, my name is Yawu Miller, and I'm the senior editor at the Bay State Banner, the largest Black newspaper in New England. I'll be serving as moderator for tonight's discussion. The U.S. House of Representatives plays an important role in American politics. Made up of 435 members, it is considered the People's House and is more diverse today than ever before. The power of a congressperson is vast. They have the ability to hold hearings, provide oversight of federal programs and offices, launch investigations, impeach members of the federal government, we've heard a lot about that in the last year, and inform the budget process. The effectiveness of their advocacy can be the difference in 1% of federal contracts going to Black and brown businesses, or 40%. Tonight, I will help center this race on issues affecting Black and brown businesses, as well as other issues impacting the economic health of our communities. As Shagun mentioned, we have only one of the two candidates tonight, so I will spend the next 30 minutes asking Dr. Goldstein the questions you, the viewer, have submitted. We'll begin with a 1-minute opening statement from the candidate. Robbie, the floor is yours.
Thank you. To talk about these incredibly important issues. We just heard in the congressman's statement about a horrible tragedy, what we now know as a preventable and avoidable death. And I think all of us are feeling the pain of his family and of his friends, of the Cape Verdean community, the Brockton community, all of us mourning his loss. And in that mourning, we must also act. We know that this summer has been filled with tragedy that has devastated the Black and brown communities of this district, of Massachusetts, and of the nation. George Floyd, Breonna Taylor, Tony McDade, Jacob Blake, Elder Fernandez. These tragedies are not simply a problem of racism in our policing system. They're not just a reflection of racism and discrimination in the United States military. It's not just the limited access to mental health and health care that so many Black and Latinx folks face. These are tragedies that are born out of 400 years of victimization, marginalization, and stigmatization. And we have to say those words and acknowledge them. Marginalization. That is the reason that Elder Fernandez didn't receive the help that he needed. It's why the government didn't act to protect his life. It's why Black and brown business owners are not able to access the financial support that white business owners can. It is why Brockton and Boston, with majority minority cities, have higher rates of unemployment, higher rates of COVID cases, higher rates of COVID deaths. We're here to talk tonight about how we can support and invest in minority-owned businesses, how we can make sure people like Vanessa, the Black woman from Brockton I met last week, can achieve her goals and live her dream. To do that, though, we have to talk about how we end stigma and how we lift up those who have been left out for far too long. We have to address racism, bias, victimization, hate in every part of our society. And that is hard work, but it's work that each of us has to do. And it's the work that the federal government must do with every policy it puts forward. I'm here tonight because I'm running for Congress. I'm running for the same reasons that I became a doctor, the same reasons I started the transgender health program at Mass General Hospital. It's because we have to fight stigma, because we can no longer live in a country where the color of your skin determines the success that you'll have. I'm eager to do this work with you, and I am eager to have this conversation tonight. So let's start.
Thank you. Let's jump right into the questions. As a resident of the district for nearly 20 years, in what ways have you supported Black and brown business issues? And what efforts can voters expect you to build on if elected to Congress?
Well, I've been a doctor for much of that time. I've been in the hospital for the past 10 years, and it's the work in the hospital that is to support the Black and brown communities that come in and are my patients. I mentioned how I started the transgender health program. It's an effort that began over 5 years ago, but was really launched 5 years back at Mass General. It was an effort that was about making sure that the voices of Black trans women were heard, that Latinx non-binary folks were heard. It was making sure that each and every single one of those was able to live a healthy life. That is the mission of the transgender health program, and it is the mission to lift up the communities that come in and are part of our program. But the federal government and my run for Congress, it's based on this idea that we can do so much more and we must do so much more to lift up Black businesses and minority-owned businesses. We have to recognize that the federal government has the power of money, the power to invest, to invest in Black-owned businesses, to make sure that those are the businesses that are getting government contracts. Those are the businesses that have access to funding and grants. Those are the businesses that benefit from PPP and other programs that are coming out of our COVID relief. We need to make sure that every program that is coming out of the federal government is doing exactly what I do in the hospital, working to create a healthy community, working to make sure that people can succeed and thrive, and working to very intentionally include the Black and Brown communities in those decisions.
Okay, thank you. COVID-19 has had a devastating impact on members of BECMA and other partners for this forum. A July National Bureau of Economic Research report found that more than 42% of Black businesses have shut down since February as a result of the pandemic. Federal programs like the Paycheck Protection Program did little to support these businesses. A Center for Responsible Lending report found that 95% of Black businesses and 90% of minority businesses did not access the Paycheck Protection Program in the first round. And in the CommonWealth itself, has yet to provide financial relief to minority-owned businesses. The question I have for you is, what specific plans do you have to get needed federal financial relief to Black and Brown businesses? Further, what will you do to push the state's leadership to provide relief to the same community?
Well, let's start by recognizing that these are businesses that exist all across the state and certainly all across the 8th Congressional District. And my opponent, Congressman Lynch, was on the air, on the record, on WCVB a few weeks ago and said we couldn't get money to businesses where they don't exist, basically denying the fact that Black and Brown-owned businesses exist everywhere in the Commonwealth and certainly all across the 8th District. I spent today driving around the district, meeting with business owners from Boston down to Brockton, into Braintree, over in Norwood, all over this district, and talking to them about the specific issues that they see in the current federal government investment in their own businesses. We talked about PPP, and we talked about how that doesn't support Black-owned businesses. They didn't have access to the same banks and the same regulatory mechanisms that white-owned businesses did. They weren't prepared to move forward with those applications. They also recognized that PPP only allowed them to build up the capital they needed to pay payroll, but not to pay rent, not to make sure that their supply chain was secure. And so many actually opted out of PPP because it wasn't actually designed for them. The federal government needs to fix that, right? And specifically move forward with a plan that is designed to include minority-owned businesses. There are great examples of this. The Restaurant Act, which is included in part of the HEROES Act, but has yet to get passed by both houses of Congress, specifically talks about how we invest in minority-owned businesses by giving a 14-day period for Black and Brown-owned businesses, for minority-owned businesses to get their applications through the cycle, to give them the regulatory support that they would need to make sure that their banks are prepared to manage those applications so that we can actually invest in that space. We should be doing this regardless of COVID, though. This investment in minority-owned businesses is not just now during the pandemic, although it's certainly needed. It is an issue that we need to drive forward with every single day. And that comes from the federal government working with states to make sure that there is a specific investment in Black and Brown-owned businesses. It is redirecting some funding that is going to the states, to potentially the prison system, right, to the criminal legal system, and moving that into a system that is supporting Black and Brown-owned businesses. The federal government has a lot of power here and a lot of ability to set targets of 10% investment in new Black-owned businesses, targets in who actually sits on advisory councils and can help make decisions about where investments go. And the federal government should be using that power to drive forward progress in states all across the country.
Thank you. As a forum for business owners, we must also talk about how to generate revenue for businesses through commerce rather than through charity. Ralph from Braintree, a BECMA member, notes that reports in the last year showed that only 1% of Boston and state contracts went to certified Black businesses. We know the federal numbers are poor as well. What will you do to ensure that Black and Brown businesses get access to federal contracts? And what will you do to ensure that all 351 cities and towns across the state provide an adequate amount of contract opportunities for these businesses?
So it's about setting those targets higher, right? Making sure that if a state wants to get federal funding, then they must ensure that at least 10% of contracts are going to Black-owned businesses. It is making sure that the people making those decisions about where those contracts go, that those people are reflecting and representing the Black and brown communities all across Massachusetts. The federal government really does have a tremendous amount of power in how it doles out money and how it does its own contracts for its own federal investment. And those also have to have the same targets. They have to make sure that they are investing in Black-owned businesses. What you brought up in this question that was very important for us to think about, right? This is not just about charity or a handout. This is about investment. This is about making sure that the supply chain from start to finish is provided by Black-owned businesses, that those businesses are being developed in communities and we can build bigger and better communities because of that investment. There's a much bigger piece to this than just simply a charity or a handout that may happen. It is about building healthier communities, which is what I talk about in this entire campaign.
Thank you. Well, Black and brown businesses across all industries are suffering because of discriminatory practices and the impact of COVID. No industry is suffering more than that of cannabis, given that most Black and brown entrepreneurs have not even been able to operate their businesses yet. Massachusetts patted itself on the back in 2016 when Question 4 was passed with provisions that centered racial equity and attempted to redress the devastating impact of the war on drugs on Black and brown communities. Unfortunately, equity has only remained a noteworthy idea rather than a laudable accomplishment, with very few Black and brown businesses able to open, and virtually none of the $100 million in cannabis tax revenue has been reinvested in communities of color. What will you do to push the Commonwealth to support Black and brown cannabis entrepreneurs specifically? And what are your specific policy proposals to legalize cannabis on the federal level?
This is another issue where I fundamentally disagree with Congressman Lynch, who opposes the legalization of marijuana. I am fully in support of the legalization of marijuana, and not just the legalization of marijuana, but actually marijuana as an industry, marijuana as a revenue-generating industry for Black and brown communities. It was last week that I went down to Theory Wellness, which is in Bridgewater here within the district, and is a marijuana establishment that is trying to do the right thing and invest in the right space. They are using their resources, their financial resources, to invest in a socially equitable way. That's where I met Vanessa, who I referenced in my opening remarks. Vanessa and her partner, Mark, are living in the district, Mark in Boston and Vanessa in Brockton. And their goal, their dream has always been to open up a marijuana dispensary, to expand those dispensaries across the state. They were unable to move forward with that because of federal policy and state level policy that really prohibited them from making that investment. First, they didn't have the capital. Theory Wellness gave them that capital, gave them the ability to invest in a retail location, the licenses that they needed. They also had issues around banking because they can't have a bank that may cross state lines and be part of their business. And there are specific pieces of legislation in front of the House and the Senate right now, including the Safe Banking Act, that will make that easier for people like Vanessa and Mark. They also recognized to me, and they said to me, that they want to make sure that they are giving back to their community. And the federal government should be helping them in that. It should be helping them think about how we expunge records of those who maybe have been convicted because of marijuana possession or marijuana sales, and making sure that those people can go out and work and potentially work in this business, in this industry. We've got to make sure that we have decriminalization all across all 50 states. So that Vanessa and Mark, their goal, they told me last week, was not just to expand their dispensaries across Massachusetts, but to expand it across New England and eventually across the entire country. We've got to make sure that we're bringing down all of those barriers, and the federal government can do this so that they can succeed in their own business.
Thank you. I'd like to shift our focus to those who may not be entrepreneurs or working at all. Prior to COVID, deep disparities already existed in employment. The most recent American Community Survey shows that the unemployment rate is double for Black residents what it is for white residents. At the same time, the conversation around the racial wealth gap was gaining steam, especially in the greater Boston area. An August 2019 McKinsey report found that if we were to eliminate the racial wealth gap between Black and white people alone, the nation would add up to $1.5 trillion to the economy by 2028. To that end, what specific policy strategies do you have for tackling high unemployment and eliminating the racial wealth gap for Black, Latino, and immigrant communities?
Let's recognize that in this country, in America, power equals money. And over the past 400 years, white people in this country have taken power, have taken money away from Black and brown communities. And we have created this enormous gap between white communities and Black communities. We have to do a lot to try to close that gap every single day. There are a ton of things that the federal government should and could be doing to help close the racial wealth gap. Now, I certainly talk about healthcare, and I think it's an important piece of this to recognize that everyone in this country deserves healthcare. It's a human right. And when we guarantee healthcare, when we unlink it from employment, we will actually begin to close the racial wealth gap. We know that those that are more likely to be uninsured in this country are Black and brown. They are living in states that have an expanded Medicaid coverage. And we can do that very quickly with legislative action. But it's beyond healthcare, right? It is recognizing the pipeline through education as well to make sure that folks can achieve all of their goals. It starts before people go into K through 12 with universal pre-K. Expanding universal pre-K in this country to everyone will have an enormous impact on Black and brown communities, because it is those mothers, oftentimes single mothers, who are unable to afford the pre-K or early childhood education for their children. When we take away that burden, when we take away that cost, we'll begin to close that gap. When we make sure that our K through 12 education system is not just dealing with racial equity on a surface level, but is actually instituting an anti-racism curriculum, we will make sure that Black and brown students succeed and excel through K through 12 education. When we deal with the student loan crisis that currently exists by making public college tuition free and dealing with student loan debt relief, we will begin to close that racial wealth gap. In every policy that the federal government can have a role, it should specifically talk about the racial wealth gap and what are the economic outcomes of that policy. If the economic outcome of any policy is to make white people richer, that's not the right policy. And we have to go back to the drawing board and think about how we are specifically lifting up Black and brown communities and making sure that that power, that money is flowing into their hands.
Okay, thank you. And we'll go a little deeper into education. An educated and trained populace is crucial to the growth of our small businesses. COVID has revealed the stark disparities in access that are present in our education system. Access to materials in one's language, to digital tools, funding resources for schools located in communities of color, or support for those students facing the decision of whether to drop out or complete their journey to a college diploma. Dr. Goldstein, what are your specific policy proposals to eliminate these barriers if elected?
I talked about some of them already, right? Universal pre-K is incredibly important, an anti-racism curriculum in K through 12, and dealing with the cost of college education or vocational school or apprenticeship or whatever it may be that someone wants to go through so that they can achieve their goals and live out their own dreams. But we also have to think, as you talked about the resources that exist. And I oftentimes think about the conversations I've had in Brockton, where high-speed internet is nearly impossible to access. Brockton, where school districts don't have the technology that they need to do remote teaching or virtual learning. Brockton, where the transportation system is so broken that when people do need to go to school for in-person learning, they don't have a way to get to and from that school in a safe way, right? We need to think about how we can invest in those communities. It's going to take some specific investment in school districts like Brockton, but it's also going to take a fundamental overhaul of how we think about K through 12 education. And as we think through that, we should be delinking property taxes and where people are going to school, and think about how we can use taxes to fund all of our school districts, not just those in our incredibly local areas. When we do that, we'll begin to make sure that school districts like Brockton, school districts with more Black and brown students get the resources that they desperately need. And other school districts in this district, like in Westwood or Dedham or Norwood, aren't overflowing with resources, right? We've got to make sure that that is distributed appropriately and evenly so that everyone has access to the education that they deserve.
Thank you, Dr. Goldstein. Thanks for your thoughtful responses to the questions that BECMA members and others have submitted. Back to you, Shagun.
Thank you very much. Yeah, we appreciate your help tonight. I know we have a couple more questions that came in from our members. So Dr. Goldstein, if you don't mind my asking just a couple more questions of you, because, so Yawu touched on economic issues. He touched on issues of education. But, one other matter for us has to do with policing. So the question that came in goes like this. While economic issues are of top concern to Black and Brown communities, matters pertaining to the criminal legal system and policing are of equal concern, given that Black and Brown people cannot hide behind their professions, their education, their location, their clothes, or their proximity to whiteness or those in power to avoid negative interactions with law enforcement. As recently as Sunday, you mentioned it in your opening remarks, we all met, unfortunately, again, another Black man, Jacob Blake, at the moment of his negative experience with police officers, being shot 7 times in the back and now is paralyzed. So this follows, all this follows major efforts to reform and in some cases abolish police practices and departments that continue to harm communities of color. So the question from one of our members is this: if elected, and it's threefold, will you sponsor legislation that ends qualified immunity for law enforcement officers? Will you work with Representative Ayanna Pressley, who recently partnered with the Movement for Black Lives to author the BREATHE Act, which would divest taxpayer dollars from policing and invest in communities to co-sponsor her bill? And are there other specific policies that you would yourself push for or put together yourself that will end racist policing practices that hold law enforcement accountable?
Yes, yes to all of those. So let's start with the first about qualified immunity, which I think is an incredibly important conversation for us to have. I absolutely support ending qualified immunity for police officers all across this country. And I will point out that Congressman Lynch voted in the past to extend qualified immunity to probation officers. I think that is moving us in the wrong direction. The George Floyd Justice and Policing Act starts this conversation and starts to think about how we end qualified immunity, but this is a much bigger battle. And we need to keep fighting. We have to fight at the federal level to get rid of qualified immunity in all aspects of the criminal legal system. We have to fight a state-by-state battle to make sure that statewide we have ended qualified immunity in all 50 states. It is a battle that is worth fighting for. It is a battle that I am ready to fight. The second question had to do with the BREATHE Act, and I very early on in this campaign came out in full support of the BREATHE Act. And Ayanna Pressley's work to move forward with that, and previously with their People's Justice Guarantee, to make sure that we are having a very comprehensive conversation about what we are funding and if we're funding the appropriate measures to keep our streets safe. I am a firm believer in data and evidence. And I can tell you that the data and the evidence show us that when we invest in communities, when we put counselors in our schools, when we fund after-school programs, when we make sure that community programs that work with the survivors of gun violence, when we make sure that those people have the money that they need, our streets are safer. Not when we invest in the criminal legal system, not when we put more money in the hands of police officers or more money in the hands of a prison system that has failed us. We've got to use the data to drive these decisions, and the data are showing us exactly what to do. The third part of that question is, what else do we have to do? And there's a tremendous amount that we have to do within the criminal legal system itself that includes things like the Andrew Curse Act to make sure that if somebody is in distress, if anyone says, I can't breathe, I'm hurt, I need help, that person can immediately get the care that they need. Like, I'm a physician, I'm a doctor, I will always be that, and I will always make sure that people who are in distress have the care that they absolutely need. It means we have to address what's happening when people, once they are incarcerated, and make sure that we're ending cash bail, making sure that we are ending discriminatory practices that should have been outlawed by the Batson decision by the Supreme Court, saying that everyone should have a jury of their peers. We know that Black individuals in this country are oftentimes tried by juries of all white people, which just passes forward that bias, that racism, that structural discrimination that exists in our country. But I have said quite often over the past 4 months that it is not enough for us to think of this only in the criminal legal system. Because if all of our solutions are directed just at the criminal legal system, we are forgetting the fact that police officers go to public schools and they learn racism in those schools. Police officers grow up in a housing system that was built on structural racism. We have to address racism in all aspects of our society. We have to be intentional about it. We have to be explicit in our language, that in every bill we talk about an anti-racist policy. And when we do that, we will begin the very long journey towards a more just society.
Thank you so much, Dr. Goldstein. Appreciate all of your responses here tonight. I have one final question from our membership and that of our partners, and it is in the area of healthcare. I think you might be a little familiar with it.
I think so.
So the question is posed as such. So COVID-19 is disproportionately impacting communities of color. This is something, again, that you have referenced in your comments tonight. It's impacting us both in infections and in death. The majority of Black and Brown businesses are located in these communities. And so the pandemic is not only affecting the lives of Black and Brown people, but also their livelihood. So talk about what you're seeing in terms of the impact of COVID-19 on our communities, and what specific policy proposals do you have to address the health disparities that are present in our healthcare system and are continuing to plague our communities?
So I'm seeing this from inside the hospital. When COVID started, when it first hit Boston, I was there in the hospital helping and serving as part of the infectious disease division. And I had 2 weeks where I was inside a new ICU that was opened up specifically for those living with COVID on ventilators, struggling for their lives. And it was not lost on me that as I walked through that ICU, the faces of the people I saw were the faces of the Black and Brown communities all across Boston and the greater Boston area. It is the reality that the color of your skin dictated whether you were more at risk for COVID-19 during this pandemic. That is because of a lot of structural racism that exists. It's because of an environmental policy that makes Brockton have the highest level of air pollution of any city in the district and makes people more susceptible to COVID. It's because of the jobs that are available, the opportunities that are there for those living in communities of color and oftentimes deemed essential workers. So people were being forced to go out and potentially be exposed to COVID-19. It is a systemic problem. We have to fix that by fixing the system. The way we fix the system is that we move to a single payer healthcare. We move to a system of healthcare that fully believes that healthcare is a human right for everyone, not just for white people in this country. We move to a system where no matter who you are, where you live, what the color of your skin is, you can walk into a hospital that is close to your house and get the care that you deserve. When we do that, and as we move along that path, much of the benefit is going to be felt by communities, Black and Brown communities in this country. When we expand Medicaid, it is going to disproportionately improve access for Black and Brown communities. When we lower the age for people to get onto Medicare, it is going to make sure that older Black and Brown individuals can get the health insurance that they need. When we reopen the Affordable Care Act exchanges and allow people to buy into the system, it's going to provide an opportunity disproportionately for Black and Brown communities. We have to do that work, because if we don't, we are going to see these numbers continue. We're going to see cities like Brockton continue to have increasing numbers of COVID-19 rather than decreasing numbers of COVID-19, like we see in many of the white communities across the 8th District.
Thank you so much, Dr. Goldstein. Your insightful answers have been, I think, very helpful to our members and those who are viewing tonight. That's unfortunately all the time that we have for this particular forum, but want to appreciate your joining us. This is a moment where we'll have you share just a 1-minute closing statement to let our members know about, again, yourself and why they should consider voting for you next Tuesday, primary day.
Perfect. Well, I will say once again, thank you. Thank you, Shagun. Thank you, Yawu. Thank you to BECMA for hosting tonight and for having a conversation about these incredibly important issues that are facing us, certainly in the 8th Congressional District, all across Massachusetts and all across the country. Since November, when I launched this campaign, I have been talking about one simple phrase, which is that I am in this race to fight for access, equity, and opportunity for every person in every community across the district. That is the message of this campaign. It's a campaign about making sure that everyone has access to healthcare, certainly, but also access to a healthy community. It's about opportunity for everyone and making sure that people can live out their dreams. And it's about equity. It's about having a framework where we can actually understand the racial wealth gap and how that was created and how we can solve it. It's about thinking critically of the policies that are coming out of Washington to ensure that everyone has access to the services, to the investment that the federal government can make. I hope that people tonight learned a little bit about me and my policies, how I really want to center these ideas in the work that I'm going to do in Washington. I hope that I've convinced people who maybe were on the fence to go out there and vote for me on or before September 1st. Early voting continues until Friday. You can mail in your ballot as long as it's received by Election Day. And I ask for your vote in this primary. I think that together, we can bring the change that this district, that this Commonwealth, that this country really needs to address these important issues. So thank you everyone for joining tonight.
And thank you, Dr. Goldstein. That concludes the third in a series of candidate forums this week in order to keep our members and our partners and our community informed about who's running for these positions. I want to thank you, Dr. Goldstein, for joining us tonight, sharing your perspectives and your policy proposals. I also want to thank Yawu Miller, who is, like I said, a staple in our community. I invite all of you to visit BayStateBanner.com to continue to stay updated on what's happening in the Black community, not just here in Boston, but all across the Commonwealth. Been around since 1965, shameless plug for the Bay State Banner. I can remember as a child the smell of the ink and it being left on my hands, picking it up in the narthex of 12th Baptist Church every Sunday. So I invite you all to have that same experience and to read the wonderful news that they continue to stay updated on to keep us all informed. Be sure to also tune in tomorrow night, 6 p.m., same time, same place here on BECMA's Facebook page or YouTube page for our final candidate forum in our series, where Janae Alstahelt from the Boston Globe will be in discussion and conversation with Congresswoman Ayanna Pressley to talk about her experiences in her first term as a Congresswoman representing the 7th Congressional District and all of the plans that she has for her second term. We also invite you to visit blackforum.eventbrite.com for more information on accessing those mail-in ballots. I think today was the last day to mail them in, but to get information on early voting or information on primary day, September 1st, next Tuesday, as well as information on how to register to vote if you're not already registered for the general election coming up in November. Again, we thank all of you for joining us tonight, Dr. Goldstein, Yawu, and all of you for watching, and we look forward to seeing you tonight. Have a good night.